Welcome to my channel Health for You. What are the different types of diabetes? There are two major types of diabetes called type 1 and type 2. Type 1 diabetes was also formerly called insulin dependent diabetes mellitus or juvenile onset diabetes mellitus. In type 1 diabetes, the pancreas undergoes an autoimmune attack by the body itself and is rendered incapable of making insulin. Abnormal antibodies have been found in the majority of patients with type 1 diabetes. Antibodies are proteins in the blood that are part of the body's immune system. The patient with type 1 diabetes must rely on insulin medication for survival. What is type 1 diabetes? In autoimmune disease such as type 1 diabetes, the immune system mistakenly manufactures antibodies and inflammatory cells that are directed against and cause damage to patients' own body tissues. In persons with type 1 diabetes, the beta cells of the pancreas, which are responsible for insulin production, are attacked by the misdirected immune system. It is believed that the tendency to develop abnormal antibodies in type 1 diabetes is in part genetically inherited, though the details are not fully understood. Exposure to certain viral infections, mumps, and Coxsackie viruses or other environmental toxin may serve to trigger abnormal antibody responses that cause damage to the pancreas cells where insulin is made. Some of the antibodies seen in type 1 diabetes include anti-islet cell antibodies, anti-insulin antibodies, and anti-glutamic decarboxylase antibodies. These antibodies can be detected in the majority of patients and may help determine which individuals are at risk for developing type 1 diabetes. At present, the American Diabetes Association does not recommend general screening of the population for type 1 diabetes, though screening of high-risk individuals such as those with a first-degree relative, sibling, or parent with type 1 diabetes should be encouraged. Type 1 diabetes tends to occur in young, lean individuals, usually before 30 years of age. However, older patients do present with this form of diabetes on occasion. This subgroup is referred to as latent autoimmune diabetes in adults, LADA. LADA is a slow progressive form of type 1 diabetes. Of all the people with diabetes, only approximately 10% have type 1 diabetes and remaining 90% have type 2 diabetes. What is type 2 diabetes? Type 2 diabetes was also previously referred to as non-insulin independent diabetes mellitus or adult onset diabetes mellitus. In type 2 diabetes, patients can still produce insulin but do so relatively inadequately for their body's needs, particularly in the face of insulin resistance or discussed above. In many cases, this actually means the pancreas produces larger than normal quantities of insulin. A major feature of type 2 diabetes is a lack of sensitivity to insulin by the cells of the body, particularly fat and muscle cells. In addition to the problem with an increase in insulin resistance, the release of insulin by the pancreas may also be defective and suboptimal. In fact, there is known steady decline in beta cell production of insulin in type 2 diabetes that contributes to worsening glucose control. This is a major factor for many patients with type 2 diabetes who ultimately require insulin therapy. Finally, the liver in these patients continues to produce glucose through a process called gluconeogenesis. Despite elevated glucose levels, the control of gluconeogenesis becomes compromised. While it is said that type 2 diabetes occurs mostly in individuals over 30 years old, and the incidence increase with age. An alarming number of patients with type 2 diabetes are barely in their teen years. Most of these cases are a direct result of poor eating habits, higher body weight, and lack of exercise. While there is a strong genetic component to developing this form of diabetes, there are other risk factors, the most significant of which is obesity. There is a direct relationship between the degree of obesity and the risk of developing type 2 diabetes, and this holds true in children as well as adults. It is estimated that the chance of develop diabetes doubles for every 20% increase over this desirable body weight. Regarding age, data shows that for each decade after 40 years of age, regardless of weight, there is an increase in incidence of diabetes. The prevalence of diabetes in persons 65 years of age and older is around 26%. Type 2 diabetes is also more common in certain ethnic groups compared with 7% prevalence in non-Hispanic Caucasic. The prevalence in Asian Americans is estimated to a 99% is in Hispanic, 13% in blacks, around 13% in certain Native American communities, 20% to 50%. Finally, diabetes occurs much more frequently in women with a prior history of diabetes that develops during pregnancy, gestational diabetes.